What good is unlimited telehealth visits if you don't own a smartphone? What good is knowing how to eat healthy if you can't afford the groceries? And how do you social distance during a pandemic if you live in a small apartment with your children and grandchildren? The first step to reducing health disparities is to recognize that 60 to 80% of the modifiable health outcomes are based on things beyond pathophysiology and pharmacology. Where we live, who we live with, what we eat, and whether we have reliable transportation impacts health much more than the tests we order or the drugs we prescribe. ChenMed patients are some of the oldest, sickest, and most forgotten members of society. They are, on average, over 70 years old with 5 or more chronic medical conditions. Most are minorities on fixed incomes, and many did not have access to care because fee-for-service deemed them as unprofitable. Even the emergency room failed them. Our patients were more likely to die from serious illness than their white counterparts. In fact, patients in our neighborhoods are dying 10 to 15 years sooner than their counterparts in more affluent neighborhoods only a few miles away. The hospital-based fee-for-service system operates in a currency of sick care. It's reactive, based on chief complaints. It's a great system if you're sick and you can afford it. But for our patients, it's a nightmare. They do not get the care they deserve. At ChenMed, things are different. We take a proactive, preventative approach. We provide transformative primary care based on a full risk, fully capitated model. That gives us the freedom to restructure healthcare so that it works for our underserved patients. So what do we mean by full risk? Think of full risk as full responsibility. If the quality of care is expensive, it's on us. If the care is complicated, it's on us. And most important, if patients don't understand what they must do to live the life they want to live, it's on us. We succeed by building trust and reducing unnecessary hospitalizations. We stay profitable by keeping people healthy. Even if they feel okay, we make them feel better. We make sure they eat well. We get them access to support services. We have social workers who help them with their day-to-day challenges. Ours is an active, engaging, dynamic system focused on improving health. We do not ration care based on the patient's ability to pay. The freedom from billing allows us to prioritize healthy days out of the hospital. And the flexibility of our full risk model to meet our patients' needs where they existed balances the scales that were unbalanced by society. For us, growing the full risk model equals health equity. If we can grow into new communities, our clinicians will meet people where their needs exist, and that includes food, housing, and transportation issues. We will transform the lives of our patients, their families, and ultimately entire communities. In the process, we will also inspire others towards a much more ethical healthcare delivery system.